Hi guys, I'm Dr. Iraniha, and today I'm excited to present a groundbreaking surgical procedure that offers a unique and innovative alternative to traditional tummy tuck surgery. If you or someone you know has been considering tummy tuck surgery, then this video is a must watch. Please join me as we explore minimally invasive approach to repairing diastasis recti and tightening the abdominal wall. Well, diastasis recti is a condition characterized by the separation of the midline abdominal muscle, commonly known as six-pack muscles. This separation is often caused by factors such as pregnancy or significant weight gain. Well, the resulting gap in the midline of the abdomen lead to an aesthetically displeasing protruding belly, weakened core muscles, lower back pain, abnormal postures, and also discomfort during exercise. Well, traditionally, the preferred surgical method for repairing the diastasis recti have been full or mini tummy tuck surgeries. These procedures involve a horizontal incision in the bikini line, followed by separation of the skin from the abdominal muscle all the way up to the rib cage. And then the surgeon proceed with repairing the diastasis recti, removing excess skin and fat, and also repositioning the belly button. While both full and mini tummy tuck surgeries effectively address the bulge in the abdominal wall and excess skin, they do come with certain drawbacks. These procedures often require a lengthy recovery period and carry potential risks and complications, including a skin infection, skin necrosis, and also the formation of postoperative fluid collection called seroma. Many of these complications are associated with extensive separation of the skin from the abdominal wall muscle, which disrupts the circulations and prolonged recovery time. Now, let me introduce you to my innovative laparoscopic minimally invasive procedure, which offers a compelling alternative to traditional tummy tuck surgery. This groundbreaking approach combines laparoscopic repair of diastasis recti with a mini tuck to remove the excess skin. In this combination procedure, I begin by making 3 small 1 centimeter incision in the lower abdomen. Utilizing specialized instruments and camera, I repair the diastasis recti from inside, covering the area from the rib cage to the lower abdomen. This eliminates the need for extensive skin separation, which is a requirement in traditional tummy tuck surgery. Next, I create a lower abdominal incision in the bikini line, only separating the lower abdominal skin up to the level of belly button. This allows for removal of this excess skin, including the 3 smaller laparoscopic incision. This part of the procedure is commonly referred to as mini tuck. By minimizing skin separation, circulation disruption, and trauma associated with the surgery, this unique combination procedure significantly reduces the risk of postoperative complications and also promote a faster recovery. Well, every patient is unique and their needs may vary. For a long time, full tummy tuck and mini tummy tuck were only available options. However, my new combo laparoscopic procedure with mini tuck offers another viable alternative, particularly for patients with only abdominal wall bulge and minimal excess skin. It is also an excellent choice for patients with a higher risk of post-operative complications seeking a less invasive surgery with a faster recovery time. With this innovative approach, I have the ability to tailor the surgery to meet the individual requirements of each patient, ensuring the best possible outcome. I encourage you to visit my YouTube channel, website, and social media platform to view before and after photos, as well as testimonial and reviews from some of my patients who have undergone this laparoscopic procedure and experienced remarkable results. If you are interested in determining whether you are a suitable candidate for this procedure, please contact my office at 949-646-8444 to schedule a virtual or in-person consultations. Thank you.